We had lots of years of supporting other people and raising funds and bringing people in and showing them different projects and doing town meetings and community meetings and interviewing community people. And I think when it was time to move into El Paso, we had to find a place to be our office. So they went driving around looking for a place to buy for a building. They had found 2 or 3 places that were pretty broken down. And so we went one last time driving up and down the streets, and there was 3607 for sale. And it had a big parking lot in the back, and it looked like someplace that we could make work. And we moved in. The next day, everything was spread out all over the place, and we kind of looked at each other like, okay, here we are.
When we were looking for neighborhoods, what we looked for were 3 values: visible need, the community would invite us in, and no competition with other agencies. So that was how we picked that particular area. We did what we called key informant interviews, where we talked to police, we talked to city council rep, we talked to neighborhood folk, we talked to teachers, we talked to social workers that serve the area.
We had an early community meeting at Zavala School, and there are pictures of, it was almost full in the cafeteria that year. They gathered and people talked about what they saw and what they wanted to see, and it was an amazing meeting to gather that community.
We'd invite the neighborhood to come in and tell us what they wanted, what they needed. One thing was housing, one thing was medical, and the other programs for the kids. So that's how Project Vida got started, with all those programs.
So we took on a condemned building at the corner of Stevens and Pera, which is the first building we did. We worked with the city and we put up a six-unit apartment complex. That was our first housing project. The issue was that for the board, when you're doing social services, you're not that committed. You can stop. When you build an apartment complex, you're committed and you're going to stay there. And that was the first of several other apartment complexes. We took over all of the abandoned and dilapidated buildings and converted them into apartments.
We talked about, for a long time, our theory moving into that community was that we needed to have lots of different activities, lots of different programs and services, because it didn't make any sense to just start a clinic and have people not be healthy and not be able to buy medicine. And it didn't make sense to just do education or housing or gang prevention or anything. We needed to do an integrated program within that particular geographical area.
The DNA, I think, has more or less remained the same. It has been that we treat each other carefully with respect and compassion. We focus on trying to build a future instead of shaming or blaming people about the past. We try to not have boundaries about what's our problem and what's not our problem. The responsibility is for everything. Even given the limits of what you've got to deal with, you have to make decisions about it, but it's not that it's not our problem. And the attempt to build a team of people who treat each other that way, who model in our lives with each other the kind of community that we're proposing other people enter into as clients, participants, patients, whatever, that it's a wholeness of life rather than giving a service to somebody poor.
We don't come with a predetermined idea of what it is that people need. And we don't come and diagnose and prescribe a solution. Instead, we are all about working directly with people to help people help themselves. Are there resources available at the local level? Are there resources that the community didn't know that they themselves had in that community? What can they do for themselves? Are there resources from local government? Are there resources from other nonprofits that work in the area? Our approach was not to assume that we were the ones and the only ones that could do the work for this community here in the Chamizal neighborhood. Our approach was to look for resources and to collaborate as much as possible. So it wasn't a matter of empire building on our part. It's more about just connecting the resources to the community.
Bill normally talks about this trinity or this triad of values, right? Which is compassion, responsibility, and freedom. And I think those summarize the core responsibility for the whole community from a place of being part of the community. So I think it's not just a response to a calling to do good for everybody around you, but it's also a response by the community itself to become, to, I guess, take ownership of the community itself, its challenges, its aspirations, its dreams, its children, its elderly, everyone. Compassion has a lot to do with, I guess, leaning on each other or remembering others and walking with others, is to carry with someone, right? And that could be to carry the load or the burden of living in an unjust world. No matter who you are, no matter where you're at in life, you are still loved and valuable. You carry some dignity, and that is regardless of who you are, what your choices in life are, and it has to do with that freedom that is inherent in people, right? The freedom to be.
Project Vida believes very strongly that we are rooted in the community, we are of the community, and we are of service to the community. Basically, everything that we do has got to be for an improvement in the lives of the people that we serve. And whether they are recipients, as clients, as customers, as patients of our healthcare services, or as staff members of Project Vida and board members. All of that is in service of the community members whose lives ultimately will be improved over time.
So I started going to these classes with my friend, and they were teaching us comprehensive sexual education. After that, I started seeking services and actually was a patient of Project Vida. After attending the classes, I was invited to join the youth action team in Montana Vista. It was a teen leadership group that was meant for teens to organize and kind of come up with different community events to try to solve the different problems that we saw in Montana Vista. And for the first time, I actually had to take like a deep look at the community and those around me, and I realized how underserved the area was. And me being involved in the teen leadership group helped me find a sense of purpose and helped me try to come up with different ways with the other teens how to address some of the underserved areas that we saw in the community. And it really helped me and the other teens in the program facilitate and foster these skills that we didn't even know we had, to organize and to plan and to really just execute these community service events was really so gratifying. It really instilled in me the values that I have today.
I was so excited to hear that one of the caregivers for this young woman that went in was a grandma. And the grandma admitted and said, these are all the things and the tools that I wish I knew that I could have better equipped my son, so that now that he has a young girl and she's turning 14, that he can better take care of her. And I'm the one that has to now teach him it's okay to talk to her about influence. It's okay to talk to her about social media and what is good and what's not so good. It's okay to talk to her about her reproductive system and if she wants to get on birth control. And she was not surprised that he was very shocked and said, Mom, like, why are you trying to raise my daughter different? You didn't teach me any of those things. And she said, exactly. I didn't have the tools. I have the tools. I'm taking responsibility. I'm giving you the tools, and I expect you to go to the next lift session. So that to me was very, very powerful because this young girl has such a strong relationship with her grandma that while the dad might not be there yet, the grandma is. And I did get to see another session, and the young girl was there and her dad was there. So, you begin to see the changes. It's a very beautiful experience to witness. What we try to do is raise awareness of all those priorities and making sure that they pay attention to the young person because these are the pivotal years for this young person as they continue in their journey to become young adults.
Just yesterday, someone came into our medical clinic and they were hadn't had a medical exam for many years. So they had the medical exam and then they started expressing that they had issues with drinking, right? And so the medical staff were able to bring over that person to the behavioral health clinic, and we were able to assess whether they were ready to change that behavior. And thankfully for us and for them, they were ready to change that behavior. And so we contacted our substance team, our recovery team, and they came and did an acute assessment. And they set this person up for on the road to recovery, right? And they set him up for the next steps. So in that one visit, this person that came in saying, I haven't seen a doctor in 3 years, really gets all of his needs met, right? In this continuum of, and in helping that person or helping that person from our community, the residents learned, right, how it is to have integrated care. And so it's really a communication amongst everyone to help the patient or the client and what they have told us their needs are. This is just one of the tenets of Project Vida, right? That we are here for the community, of course, and then also the next on our list of priorities is our staff and the people that make all this possible, right? We could not do what we do without our support staff and without everyone involved. We're a team, right, here at Project Vida, and so we really take that seriously, right? And we really try as best to support each other.
Sí, nosotros conocimos a Proyecto Vida, estábamos en el shelter de Willy Sánchez y gracias a la manejadora de Willy Sánchez, ella fue la que habló con Proyecto Vida por mi hijo que tiene Down y fue así como los conocí.
Fui, me visitó porque estamos viviendo en un departamento que no era adecuado para mí, para nuestros hijos. Fui, nos visitó a la casa que estaba nevando y me acuerdo que esa vez estaba haciendo mucho frío y entraba el aire y fui, me tocó y ya me dijo que si estaba dispuesta ya a venirme para acá y nos explicó el programa. Luego no tardó, me dijeron que perdía el proceso era de 4 meses, no, ni el mes tardó. Luego porque vieron en el departamento que no teníamos ni gas y no tenían o sea, se goteaba, el piso estaba todo cuatripeado y luego nos jalaron para acá.
No, pues fue, haz de cuenta, como la luz al final del túnel, porque sí, ya de Willy Sánchez fue como nos enteramos de Proyecto Vida, pero de ahí nos movimos a la Florence, en el apartamento donde fue Margie, y ahí fue donde la conocimos. El impacto fue un cambio de 360 grados, que eran más los problemas, también era por el área en el que estábamos en el segundo y de un vuelco, como te digo, total de 360 grados. Ya mis hijos se alejaron de ese lugar donde estaba muy peligroso y aquí, pues, te digo, nos cambió la vida, la verdad. Yo tengo 5 hijos. De los 5, 3 son ciudadanos. Es por lo único que agarro estampillas. Y es bien difícil. Es bien difícil, en serio. Y no me va a alcanzar la vida para agradecerle a Proyecto Vida lo que ha hecho por mí y mi familia. En serio. Que Dios se los pague. Se los digo de todo corazón.
Project Vida means a lot to me. My mom started Project Vida as a volunteer, I don't even know, 20 years ago, and if not longer, about 20 years ago. And she, started because she wanted to get her foot in the door. She since has grown so much in the agency, and that has allowed me to also grow within the agency. I, as a little girl, used to come and receive the after-school services. We actually also used to live in one of the apartment units in Project Vida. We lived there for a few years, and then from there, I started working as a volunteer here. I used to come and help out during the health fairs when I could as a teenager. And there was a position that opened up. It was a part-time position that opened up about 10 years ago, and I took it. And I've been here since. Project Vida has also allowed my family, myself, the ability to create a career that really fulfills us. And through that career, we've been able to help generate impacts in others. She has grown so much. Professionally, of course, she has gone through every promotion she can at this point. But I think personally, she's grown in the emotional intelligence so much, and she's become a leader. And that leadership, those leadership qualities that she possesses have been something that she's been able to influence. For example, now my son, who is 4 years old, my son is her little twin. And so she's able to have an impact in her house. And that has been something that Project Vida has allowed for her to do, because it's provided her with so many tools and opportunities and guidance to get there. And I'm seeing the fruits of it now, again, not just professionally, but also in a personal way.
In the early days, there was a desire to actually serve directly in kind of a person-to-person way. But as Project Vida has developed, it's become necessary to raise money, to train staff, to hire people, to have an administration. And more, I think we've become needing to do those kind of decisions, those kind of administrative guidance and direction.
Vida means life in Spanish. It is also the name of an award-winning program that addresses the health needs of people along the Texas-Mexico border.
The church was looking for practical things that they could do and ways that they could be a part of some kind of a project that would serve people.
Many of the church people were volunteers and knocking on doors in the neighborhood and trying to figure out what the needs were and how we could design programs to respond. Some of the medical staff initially were church folk, and then more and more community folk began to be involved, and it's become a broader-based program since then.
Through unique outreach and service integration strategies and community development, Project Vida does indeed offer them life. Today, Project Vida supports over 1,300 families with much more than primary health care alone. As a system of integrated services, it keeps their children in school, finds them housing, discourages gang activity, and provides a host of social services.
It has been amazing, the trip. I think that we start just being like 8, then COVID hit, everything changes. We ended up just being 2. Suddenly, I just took the position as a supervisor. Now we're getting and being 20 employees in the program. We have grown so much. We used to be only the micro enterprise technical assistant program. Now we have the CDF5. Now we provide a specific technical assistance to the child care centers and home base. And we have been growing a lot, providing grants, PPP, strengthen the relationship with different partnerships and resources. We're looking forward to expand our services wherever the need is. I think that that's key and very important for us. Right now, well, we used to only be in the Paso City limits. Now we are expanding our services to the Socorro area, to San Elizario, and we're getting offices there. Right now, we just got a visit for Van Horn. It's too far away. It's so difficult, but
I can see our program going over there, expanding our services, because if a lot of micro enterprises from Banghorn and even Presidio are coming to us, is because they have seen and heard about the services that we're providing and because they still have this need. So we want to follow up the mission of Project Vida, which is to look and do programs that can meet all the needs that the community has.
We hire people because they believe in our vision and our mission, and we all feel the same way, that we're here to serve the community. And a lot of the people that we have at Project Vida Health Center and Project Vida as a whole are people that are from the community. They're us, we're them.
The reason why I continue doing what I'm doing, and the reason why I continue being at Project Vida, is first, I love what I do. Even though my day can be crazy, it's unexpected. I love what I do, from finance to payroll to HR to teenagers, everything. I love it. Project Vida is a family-oriented organization. When I began administration, it was probably around 120, 125 employees. At the moment, we are 300 employees. So there's been a lot of growth.
After starting off in Project Vida, and it really helped me nurture those skills that I mentioned earlier and facilitate the growth that I had as a team to now. Every step along the way, Project Vida has been there with me when it's come to my personal choices in healthcare, when it's come to believing in me as a team leader, believing in me as a community member. Every step along the way, it's facilitated my growth as a person and my growth in my values and my skills. Had the inkling to apply myself to medicine and to apply to medical school. And I really believe that having the experience with Project Vida and having the skills facilitated by them is why I'm a medical student today, and I'm on my journey to becoming a physician in the future, so that hopefully one day, at least it's my goal, to be able to come back to a community like Montana Vista and practice there.
We have very creative people. Our leadership is very creative. The way that we write grants, the way that we structure our programs is basically to do that, to create sustainability so we can keep bringing services, bringing programs, and not closing our doors and not closing our minds to just because it's not available, we're not gonna bring it. We'll find a way, and I think for 30 years, we've been doing that. You need to care about your community. You need to care about the job that you're gonna be doing. You need to have a call for service, because that's what we do. Even if we're not in the front line, even if you're finance and payroll and communications line, be that we're not the front lines directly with the community all the time. We know that everything that we're doing is because of a program that is providing the services out there. So we know that the job that we do, the work that we do here, has a bigger impact in the people's lives out there.
El mensaje de Project Vida, el ADN de Project Vida, yo creo que es servicio, es crecimiento. Project Vida siempre piensa en la gente, cómo pueden crecer, cómo pueden mejorar en todos los aspectos de la vida, como mencionaba, salud, educación, en todo lo social, en lo económico también. Ese es el ADN de Project Vida, el servicio.
I don't think we built on anticipation. I think we built on a journey, and when you take a journey, you don't always know where it's going to end up. What I see now is not so much, oh wow, look what we've done, as, you know what, there's a need over there. People deserve to live in decent places. We're retiring because we can't keep up with where Project Vida is now. Where it needs to go is still much further.